Welcome to Your Health in 15 Minutes. I'm your host, Dr. Monique Wallace, and today I am joined by Dr. Christy Swinson and Dr. Michelle Bates. With May being Lupus Awareness Month, today our theme will be lupus. Dr. Christy Swinson, can you please introduce yourself?
Yes, good morning, and thank you for those that are watching. I am an associate professor at Fayetteville State University School of Nursing. I have been teaching for about 17 years, and I'm also a certified family nurse practitioner with 26 years of healthcare practice experience.
Thank you. Dr. Bates?
Yes, I am Dr. Michelle Bates. I'm an assistant professor here at the School of Social Work. I have been with Fayetteville State University since 2017 as an adjunct, and then full-time since 2021, teaching in our social work department in the Masters of Social Work program.
Thank you guys so much for joining me today. So let's talk about lupus. What is lupus?
So lupus is a chronic, lifelong autoimmune disorder that impacts so many people. It is a condition where the body mistakes healthy tissue and cells for unhealthy tissues and cells and mistakenly attacks it. So it's something that we do not have a cure for, and again, it's chronic and lifelong.
Okay. And how common is lupus?
In terms of looking at how common it is and the demographics, we have about 330 million people in the United States, and out of that, about 1.5 million people have lupus. Each year, about 16,000 new cases are diagnosed, and when we look at it disproportionately, it does affect minorities. You will see, in terms of the cases, you will see African Americans, you'll see Hispanics, also Native Americans, some Pacific Islanders. Does not mean it does not affect Caucasians, but it's 2 to 3 times more likely to affect those that are African American or considered black.
Okay. And what are some of the symptoms?
So lupus is a great imitator. It mimics other conditions. And so some of the symptoms are very similar to other conditions that people may have. So those conditions are depression, fatigue, muscle aches and pains, skin rashes. Sometimes it's marked by a butterfly rash that goes across the nose and cheeks. Hair loss, hair thinning, brittle hair, changes in bowel and menstrual cycles, bleeding and urination. So there are several different conditions and things that we see, and it looks different from person to person.
Okay. And how would they diagnose someone with lupus?
So that's a great question. Diagnosis is very difficult just because a lot of times, just as Dr. Bates mentioned, the symptoms does mimic a lot of other diseases. Once you come in and you have those complaints, which we call subjective complaints, it's important I encourage those that are even having any kind of symptoms to keep a diary in terms of what you're seeing, the differences you're seeing, what changes in your body. When you go to your healthcare provider, what will happen is they'll do a thorough physical examination. They'll also get all that information in terms of the changes that you're seeing in your body, the concerns that you're having. They'll inquire probably about your medical history and family history because it does have some genetic predisposition, what they found, and they don't really know what causes lupus, but they found that in first degree relatives, also environmental triggers, sun exposure, a number of things they found that of viruses of why you may develop lupus. But the provider, again, will do a thorough medical exam. They also may do some lab work, which will include a complete blood count that looks at do you have any anemia, also if you have any decrease in platelets, which are also commonplace with those with lupus. They may also, as Dr. Bates mentioned, because it does attack your healthy cells in your tissues, they'll look for the presence of antibodies. So they may do what we call like an anti-nuclear antibody test, anti-cardiolipin test. So there's a thorough test they can do. It's not just a one-size-fits-all. So there's not one test where we can say, yes, you have lupus or no. So they kind of look at a number of things in terms of, are you having any rashes? What are all the complaints that you're seeing? Do we see any changes with your heart or kidneys in terms of complications of lupus? So there's a number of things that they will look at, and then also the provider may collaborate with a rheumatologist or someone else to do further detailed testing.
Okay. You know, I like that you said that it does have a genetic disposition. I have one family member, first cousin, who's passed away, and then close family member who actually is living with lupus right now. So definitely near and dear to my heart is the topic. So Dr. Bates, you did say that there is no cure. So I would assume that the treatment would be, you know, to help with the symptoms that you're having. What would treatment look like for someone who was diagnosed?
So did you want to go ahead and
No,
answer?
go ahead.
Good. So I just wanted to mention and say, from a provider standpoint, as a family nurse practitioner, what I've seen with working with other providers and specialists, again, it's going to vary from person to person. Even the presentation of lupus varies from person to person. That's why it's so difficult to get a diagnosis initially. But treatment is going to be focused on the symptoms that the person is having, because as Dr. Bates said, there is no cure. Also, the treatment is going to be focused on preventing complications. So based on the type of lupus that it is, one thing to make you aware, there are different types of lupus. The most common type of lupus is what we call systemic lupus erythematosus, which is about 70% of the cases. But we do have some that are also affected by what we call discoid or cutaneous lupus. And then there's also sometimes people have drug-induced lupus that comes from certain medications that they've been taking. So with systemic lupus and discoid lupus, systemic, you have that common of the rashes you may have sometimes. Also, you'll have the effect in your lungs, your heart. They may get pericarditis. They also may have lupus nephritis that affects their kidneys. With discoid lupus, you see that photosensitivity, or when they're out in the sun, those rashes, they may get lesions as well. So based on that, the provider will do a treatment plan. Many times with that treatment plan, it'll consist of non-steroidal anti-inflammatories. So that would be like your Motrin, Aleve, Advil. In the hospital, we do give quite a bit of Ketorolac or Toradol. Also immunosuppressants, so they may be on corticosteroids, and we know with a lot of these medications, they do have side effects. Some providers will order anti-malarial medications. They'll also order chemotherapeutic medications. So it just depends, the goal being to suppress the immune system, to stop attacking those healthy cells and tissues, and also, as I mentioned before, prevent complications. Because with SLE, it wreaks havoc on your blood vessels. It can affect any organs, your body tissues. I mean, it essentially affects everything, and even the person's mental health as well. So it requires, collaboration with the primary care provider, with a rheumatologist, cardiologist, nephrologists, dermatologists. They'll have a whole team, social work, depending on what the person needs and the support that it entails with resources, which Dr. Bates will address and talk about. But it's very important for them to have a team in place in order to meet their needs.
Sounds like it will be holistic, complex care for the patients. So Dr. Bates, are there any resources within our area for patients that have been diagnosed?
Yes, and the biggest resource I want to point out is with Lupus Foundation of America. They have taken on the initiative in ensuring that minority communities are well educated about lupus. And so they've launched the Be Fierce Take Control campaign. And if you just go to BeFierceTakeControl.org, that will send you straight to some local resources and national resources. And then, of course, we have social workers who are trained to provide those resources, and that is just across the state. So at BeFierceTakeControl.org, they do have a symptom checker quiz that you can take. And once you complete that, it will either alert you that you may want to speak to a medical provider and give you the option to speak with a health educator for free.
Last but definitely not least, are there any myths about lupus that we should know about?
Yes, and when we think about the myths and misconceptions, I did touch on one of them already. Some individuals may think it only affects African Americans, although we have a higher prevalence with African Americans as well as Native Americans, Pacific Islanders, and those of Asian descent. Also, those that are Caucasian can be diagnosed with lupus. Another misconception is that it only affects females. 90% of those that have lupus are females, but males can also be diagnosed with lupus as well. There's a lot of misconception and myths. People think that lupus is a form of cancer, although providers will maybe sometimes utilize chemotherapeutic agents as immunosuppressants. It is not a form of cancer. It is an autoimmune disorder, which was already described by Dr. Bates. Another thing that I wanted to mention is some people think that it's a form of AIDS, and the amount of some of the discrimination that is experienced by those with lupus. It's not a form of AIDS. It's actually the opposite. We know that with acquired immune deficiency syndrome, the immune system has a decreased response. However, with lupus, it's an overactive response. So it attacks those healthy cells, those healthy tissues, as well as pathogens. It can't differentiate. So it's like your immune system is almost in overdrive. So that's another misconception. Also, for those that are wanting to have children, although because lupus does increase estrogen levels, it can make it difficult to conceive. However, you can conceive with having a diagnosis of lupus. Of course, you'll be in conjunction with your OBGYN and also other specialists to ensure that you have a good outcome. But those things can be taken care of as well. Also, there is not a cure for lupus. However, there's a lot of medications. There's a lot of new medications to improve the quality of life of those individuals, as well as think about your immune system. So even things such as exercise, reduction of stress and triggers, healthy diet rich in fruits, vegetables, antioxidants, staying well hydrated, making sure you have your vaccines, reducing your risk of getting illnesses. All those things are just as important in terms of supportive care, along with what the provider recommends.
Great. Thank you so much. Is there anything else that you guys want to add about lupus and Lupus Awareness Month?
I just want to add that the common ages that you see for lupus, the common ages in terms of when we see a diagnosis is ages 15 to 45. However, I wanted to bring to the audience attention that you can be diagnosed earlier than 15. As a matter of fact, with African Americans, for those that are diagnosed with systemic lupus erythematosus or SLE, they tend to be diagnosed at an earlier age. And also, we tend to have, African Americans tend to have greater complications, more severe complications. So that's something to consider as well in terms of why we need to be very aggressive in their treatment plan and also doing early referrals.
Now, this may be a myth, I'm not sure, but it's something that I've heard. The earlier the diagnosis, the worse the prognosis. Is that true, or does it just depend on the patient?
I would say it depends on the patient, and it depends on where they are in the severity of their symptoms, because again, it attacks those healthy tissues, and sometimes it attacks major organs. And so if you are diagnosed early, you're diagnosed when you have very minor symptoms, very mild symptoms, and they can get in and provide you with the medications that Dr. Swinson talked about, the prognosis could be a lot better. But again, it's person to person. It just really depends on what's happening with that person, what's going on, and what treatments they need, because again, there's multiple types of lupus, and it could be that one person's treatment does require a little bit more aggressive work versus someone who may have caught some very early symptoms and maybe the treatment doesn't have to be as aggressive. It just really depends.
Okay. Well, thank you guys so much for joining me today. It was a pleasure having you here. Again, my name is Dr. Monique Wallace, and with me I have Dr. Christy Swinson and Dr. Michelle Bates, and today we talked about lupus awareness. Thank you guys for joining Your Health in 15 Minutes. Stay hydrated and stay cool.
Thank you.
Thank you.
That's it, guys.